Good afternoon, everybody. I'm Dr. Latha, Professor of Department of Obs and Gynae at Jipmer. So I was given the task of talking on audit of maternal mortality. So I'll just go with the history of how it all started. In Jipmer, in the year 2007, telemedicine was started to ISRO satellites. Then we started webinars from 2010 itself, and we played a significant role during the pandemic. So generally, what is this maternal mortality meeting? This is basically an audit of all maternal deaths, which is supposed to be conducted all over the country, which happens regularly in all the states. So first at the department level, then at the institute level, then we have at district level, then there is a discussion at the state level about all the deaths of that month. Now, why a maternal death audit? Basically, we should realize that to improve maternal mortality rates, it is very much necessary to see how are we managing patients. So from these we learn lessons and then improve our, so go back, do a root cause analysis, identify the factors which have led on to the maternal death, improve our management strategies, and finally build guidelines according to the local needs. So each maternal death is notified to the state health authorities through maternal death review forms. So what we do in our department is, if any of the deaths which have occurred, discuss, suppose the deaths in April, we discuss in May. Luckily, we don't have, death rate is not so much. If the case is presented in detail by the first responder, every relevant point is discussed among the faculty and residents in the department. Any questions are raised. We identify factors which have hindered the management, identify what is the cause of death, and we also see if there is any strategy to prevent further death. So department audit is monthly. So this is what I have said. Then we have a district level audit. It is done in presence of relatives of the disease. Relatives are free to ask questions to the treating doctor. Sometimes the management of a patient is not from just one department. It could be from primary health center to Jipmer, in between whatever hospitals they have been referred to. So then the district health authorities, and of course there are a team of experts who would be discussing about each and every case. If there is anything obvious or something which has grossly gone wrong, then it is identified and picked up. Okay. Then we have a state level wherein the health secretary conducts the meetings. Usually it's monthly, but sometimes due to lack of time or whatever, it takes maybe once in 2 to 3 months where they collectively discuss all the deaths which have occurred in the state. This is in Tamil Nadu. We do also have in Pondicherry. So this is to again identify preventable and rectifiable factors, wherein the panel of experts and the doctors who manage the case present. So what happened during pandemic? We've had physical audits were withheld since March 2020, obviously for the reasons. But again, audits are necessary. Just because there is a pandemic, we can't stop the audit. So early in April, we went on to the student portal, web portal, and it started off with student lectures. And it also had extended to online postgraduate classes. When this was happening, there was no clue of when physical meetings would actually happen. So we started conducting our maternal care review meetings as usual online. All the residents, and except one or two residents who were presenting and some faculty would be in the hall, the rest all would attend online. The advantage of this online meetings was, if you have to be physically present, many of them might have missed the class sessions either because they are post duty or on duty elsewhere. With this, even those who are working in labor room, whatever little time they could have, they attended. But the disadvantage was many times there were connectivity issues. So they join or sometimes, like students join the webinar and switch off the videos. To overcome this, we used to interact with the residents by calling again. Then district level audits. So this also started happening from April 2020. We have had almost over past 2 years, some 7 to 8 audits. It continued till this March. Audits were held once in 3 to 4 months, but now the district level audits are physical. We would still like if the audits are continued online. I'll come to it a bit later. State level audits, again, this was not during the time of pandemic that it started. The video conferencing started even before the pandemic, much before, from Tamil Nadu, just for logistic purposes, because everyone can't travel to a single place for conducting this audit. So it was through NIC portal. In Jipmer, the Department of Telemedicine was established unit of telemedicine was established since 2010, and it still continues. So this is one of the examples of the state level audit. The advantage of video conferencing. What are the advantages? Team which was involved in a particular patient, management could discuss. When it was physical meetings, especially when there are, suppose in a month we had 2 to 3 deaths, or if they are discussing over 3 to 4 months, deaths of 3 to 4 months, it should be various units and various doctors who were involved in the management of the patient. It was difficult for all of us to go. And it's also difficult for one person who doesn't know anything about the patient, and they have to go and present. So that is the biggest disadvantage of physical meeting. So that was overcome by video conferencing. And not only that, during the time of discussion, we could be there. Rest of the times we were continuing with our department activities. Could it be OT, or operation theatre, OPD, or student activities? It saves a lot of time and definitely human resources, and the travel time and all the expenses involved in maintaining all this. Residents also could be exposed to audits because many of them could attend, which is a very good learning experience for the residents. But the limitations of telemedicine have always been connectivity issues. If you don't have a stable, all of us know that, if you don't have a stable internet connection, then this has always been a problem. Physical interaction with each other is restricted. We don't get to meet people, even if you see it's like hello, hi, but that is something which is really missing. The human touch is missing. And at district level, we usually interact with attenders, which may be restricted online because all of them may not have network connectivity or internet availability. So these are the biggest disadvantages. So teleconsultations, other things we have done is teleconsultations during the pandemic. Smartphones were issued to every department. Mainly we had contacted patients. They had to register prior online, or there was a number which was given for each department. So patients would contact them, and those people will be registered on whichever day the patients want to. Later on, we had access to the number of patients unit-wise, where we can contact the patients on our own, and then we used to do a lot of teleconsultation services. It was a very nice learning, but yet it was very, very useful. At least the patients were comfortable, especially pregnant patients. At least we could tell them what they should do. We also had some kind of video mode when they had to show the lesions, or if they want to show some reports. It was very interactive. Unnecessary visits to the hospital were avoided. In fact, there were many PHCs who started conducting deliveries. So our except the number of normal deliveries, low risk patients who were visiting the hospital definitely had reduced. We could cater to high risk patient and give quality care to these patients who are referred. And we did encourage them to deliver at local places, but the moment pandemic is over, they are again back to us. But sometimes other problems were they had given wrong phone numbers, or we could not contact patients because they were continuously switched off. So these were some of the things which we had come across in teleconsultation. So this was another court case which was attended online by one of the residents. Of course, it was a video conferencing to Maharashtra through NIC. So this is another biggest advantage of this telemedicine. So I have very little to say. So to conclude, e-discussion of maternal mortality is most welcoming. It should be continued at district level to overcome all the logistic issues, as I've already mentioned. And I think this kind of meetings are good and will be more effective than going in person. taking a vehicle, traveling so far, and we don't even know when we'll come back. But at least this thing comfortably we can do it from the hospital itself. And it will also allow hospital services by the doctors, which will be more efficient. And we can avoid unnecessary visit of patients to the hospital. So I would acknowledgement this for all the faculty of the department, residents, and for the department meetings and attending the order for them, because they were attending department meetings and did audits. And I also acknowledge a unit of telemedicine, Dr. Chikoria, Dr. Kalayarasan, Mr. Mohammad Ishaq, Mrs. Kavita, and the entire team of telemedicine. Thank you.